Welcome to our practice number 6. This one is called knee bending or janu, which is your knee naman. So starting in base position, sitting tall, lifting your heart, leaning back very slightly, and just take a few breaths before you begin. Center yourself. If you haven't already, take a little pause from the previous practice, take a good minute just to allow everything to settle and notice whatever you feel, remembering that the rests are almost as important as the exercises themselves. We're going to take our left leg first. We're going to bring the left leg in. We're going to interlace our hands underneath the left thigh. So you're trying not to slouch here. We're still trying to sit up nice and tall, lifting the heart. Bringing the left leg in, so the heel's just a little bit off the floor, and then we're slowly going to push the leg away, so the heel should be about 10-15 centimetres off the floor. Hold, and then slowly bring the leg back in, drawing the knee all the way back to your chest. So we're slowly straightening the leg, you're pulling up the kneecap, and then gently bringing it back in. Slowly pushing out. Contract the kneecap. You're used to doing that from exercise number 5, our last one. And then bringing it back in. So you're going to do that 10 times and then place the leg back down. And then slowly being pushed off my mat by Bodhi. And then coming over to the other side, we're going to pick up the right knee, sitting tall, squeeze the knee in towards your chest, and then slowly push the heel away. So it's 10 to 15 centimetres off, hold, and then slowly drawing it back in. Pushing it out, and drawing it back in. Pushing it out, remembering to contract the knee as you straighten the leg, and then drawing the leg back in. So again, 5 to 10 times on that side. And then we move on to part 2. Now part 2 is a little bit more strenuous, so if you've got any abdominal issues, maybe if you're pregnant or just had a baby, or you've got any lower back issues, anything around this area, or maybe even knee pain, because this can be quite strong on the knees, then maybe you should avoid this one and just continue practicing the one leg at a time until you feel strong enough. Starting in our base position, this time we're going to bring both legs up, going to hold underneath the legs, and we're going to balance on our bottom. Going to point the toes forward. You can just find your balance, take the toes on and off a few times, just find yourself in a nice steady position. And then very gently, you can use the hands to help support you a little bit, but not too much. You're going to straighten your legs. Now you might not be able to come to here, that's absolutely fine. You might be able to straighten them a bit more. You can lean back a little bit to counter yourself. Toes are pointed, kneecaps contracting, hold 3 to 5 seconds. You'll notice that your arms are straight here. And then ever so slowly, you're drawing the feet back in. And at this point, you keep the heels hovering off the floor. Draw the toes back towards your knees. That's one round. And then we slowly come all the way out as we breathe in. Hold 3 to 5 seconds. Exhale. Coming back in. Hover heels off. Draw the toes back. We'll do 10 rounds of this. Pointing the toes, contracting the kneecaps. Holding, gazing at your toes, lifting your heart. Tuck the chin in a little bit. And then slowly bringing ourselves back. Draw the toes back. inhaling out. Now all these exercises for the legs are moving the circulation around, they're helping move the lymph around the body. They're really good for your heart. So take it nice and slow. Just because you're moving slowly doesn't mean things aren't working. You can probably feel it in your legs, your core a little bit. So coming back in, heels hover off, draw the toes back and release. So we'll just sit for a moment after that one before moving on to the next exercise. So sitting quietly, perhaps closing the eyes, feeling any sensations in your upper legs, your knees. Big breath in. Feel the chest lift as you breathe in. And exhale, relax the legs, the shoulders. Thank you for watching.